So what do we do? I mean, that's my question. When I read this literature, I think, gosh, I feel like I should be doing something. I need to know more about this. What can I do for my patient in the clinic? So there are a variety of approaches that can be taken, and these are definitely things that are encouraged and recommended in human medicine because a lot of the uremic toxins, especially the smaller ones, actually cannot be cleared by dialysis. And so in human medicine, especially when dialysis, like in the US, it's very common to do dialysis, that's a major problem. Even if I can fix your creatinine, I actually cannot clear some of these other uremic toxins. So there are strategies that they recommend in the human health to try to target uremic toxins. We have dietary modification. We'll talk about that more. That often includes fiber modification on the human side, and then prebiotics, probiotics, and then intestinal absorbents. And that would be the category that porous one would fall into. But there's lots of other things to think about in terms of your general management of the patient that I think that we should be aware of. So I do want to speak a little bit about dietary modification because this very much relates into some of the dietary conversations that we're having about cats and what our diet recommendations are for them. And the reason for that is because it is that protein level, again, that's potentially feeding the production of specifically indoxyl sulfate, but some of the other uremic toxins as well. So what do we currently know about that? Well, on the human side, there's multiple studies and in rodents that show that higher protein levels in the diet can result in higher uremic toxins. So for instance, there's a study showing when even healthy humans eat a high protein diet for a couple of months, they have higher indoxyl sulfate. Can we show that to be true in cats? Well, actually, Dr. Summers and I did do a study looking at a little bit of a higher protein diet and what would we see for uremic toxins. And it does turn out that after 8 weeks, those normal cats, they would have a significantly higher indoxyl sulfate level eating that higher protein food. Again, I guess what we don't know is that increase in indoxyl sulfate enough to actually cause them problems? We don't know that piece of it, but we can definitely show there's a relationship between the protein level in the food and the diet. And so, sorry, the protein level in the food and uremic toxins. What do we know in kidney disease? There is one study out there that shows that iris stage 1 cats fed differing protein levels in the diet. As you increase, again, the level of protein in their diet, they do have more uremic toxins. So somewhere here we have to have a balance. What we don't currently have is data for iris stage 2 to 4 cats to figure out what happens with different protein levels and uremic toxins. And I put this picture up here as a reminder. I don't necessarily mean extremely high protein levels. That hasn't even been studied. This is just a moderate increase in protein. And again, we have to ask ourselves, how much is too much protein? Because the reverse side of that actually is appropriately supporting muscle mass. So there's a balance between these two things that we have to be concerned about. Our goal is to provide enough protein to avoid protein malnutrition and have good muscle mass, but not too much that we would actually be making those uremic toxins. So hopefully this figure kind of demonstrates it. We've got to figure out what they actually need and then what is actually too much. Because of course for cats, they are carnivores. They have a number of essential and non-essential amino acids that we need to pay attention to. And it's going to be this balance of diet that we need to know more about in order to do the best job for them. And again, that higher protein content would very much be a concern for forming more uremic toxins. The other kind of interesting piece to this, which is shown by some of the human literature, is that when you have kidney disease, you may actually not do a great job absorbing the proteins and the amino acids in the first place. So that's a bit of a concern because if you give someone a protein load and they have kidney disease, again, they're just not getting the nutrition out of it that they need. And that's what this study shows, is that hemodialysis patients just cannot absorb amino acids as well as others. So that we don't know that information for cats, but it very quickly becomes kind of sticky, because the thing that we do know for cats is they have amino acid deficiencies when they have chronic kidney disease. So this study that we did showed that, in fact, if you looked at tryptophan, which is our precursor for that indoxyl sulfate, it's actually not getting into the bloodstream as it would in the normal cat. And cats with kidney disease had lower levels of several essential amino acids and non-essential amino acids. So even though they're eating protein, they might not actually still be getting enough, but we still have to balance that with this concern about uremic toxins. So where does that leave us? And again, tryptophan is the one that I think about when I'm thinking about that indoxyl sulfate. We also know then that they're muscle wasted, especially as they go through the stages of the kidney disease. And so we have this balance that we have to discover between being concerned about a buildup of uremic toxins with diet and then also maintaining muscle mass with the protein. And we are still absolutely figuring out where that balance is and what's the best thing to do for our feline patients. And I worry, as I look at all of this information, what might be happening is that, again, they ingest the protein, and hopefully enough protein, eating their caloric intake. They have to be eating enough calories. I can't stress that enough. That's where, our appetite stimulants and everything else comes in. But then even the protein they're eating, they may not actually be absorbing properly. And where does that leave that protein? Well, it leaves it sitting in the colon, potentially putrefying, and then being taken by the bacteria and being made into uremic toxins. At the same time, muscle wasting is also occurring. And my take on this is that feeding more protein is not necessarily the solution to this, because if they can't absorb it very well and it's just going to turn into more uremic toxins, we need a different strategy. So there are lots of folks out there that say cats need high protein diets for kidney disease, and this is why I really worry about that recommendation. The uremic toxins is a big part of it. And I think we need definitely some more study here to figure out the best way to approach this and what really appropriate levels are.